We've been reporting on the dire need of personal protective equipment, commonly called PPE, for medical professionals. A Yale University professor is working on a national solution, and she's with us this Sunday. Dr. Kiki Kennedy is a psychiatrist and assistant professor at Yale Medical School. She's here to talk about the program Need Masks Today. And Dr. Kennedy, great to see you here with us today.
So great to be on, Dennis. Thank you.
So first of all, how are you and your family coping during this quarantine? Everyone's healthy?
Thank goodness we're all healthy. We're all together. Yes, and I hope the same for you and yours.
We certainly are busy and quarantining and having all sorts of fun, but we do have our health, which is great. So many people don't during this crisis, and which is why we're talking about this today, because you've been talking with a lot of doctors you work with at Yale, and they're telling you about what they need on the front line. So what are they saying?
So I work with a lot of the resident physicians at Yale who are on the medical front lines. They're in the ICUs, they're on the hospital floors, they're in the ERs, and they're doing what every healthcare system across the US is having to do to preserve the PPE that is in such short supply. They are resorting to CDC crisis strategy protocols. That's where an item that is supposed to be used only one time needs to be used over and over and over again in order to extend its life, because there's not enough supply in our national supply chain to be able to use them according to CDC standard protocols.
So you kicked this off with a virtual March for Masks. Tell us about this.
So on Saturday, we had a fabulous rally before our march. It was 2 hours, actually, of several panels of experts who delved deeply into the PPE supply chain shortage and what we can actually do to address it. We had panels moderated by professional journalists. I'm sorry you weren't there, Dennis.
Next time.
But we had physicians, we had legal scholars, historians, and supply chain people who were have talked about their scrambling in order to be able to secure enough PPE for their healthcare system. And I think we all learned a lot. And then at the end, we marched. And what we asked people to do was to write their governor and ask their governor to call on the White House to invoke the Defense Production Act for PPE. We actually had a really great tool, which may still be working today, where you can text DPA, which stands for Defense Production Act, for the number 4 PPE, to a number, which is the number is 52886. And if your viewers want to still do it today, I think it's still going to work.
Well, we'll certainly check up on that. How are people reacting to this?
We had, it was a fantastic program. We had marchers from all across the United States. My understanding is we've gotten mail letters to almost every single governor in all 50 states and to congressional leaders as well. And so we're really hopeful. We also partnered with quite a number of other organizations, Get Us PPE, Masks for America, Masks Now, Impact for Healthcare, the American Medical Student Association, and the American Psychiatric Association. So we are networking with all of our colleagues, trying to do this together, because we do realize we're all in this together.
At the top of the broadcast, Congressman Hyams was talking about how so many people are anxious these days. And as a psychiatrist, I want to ask you professionally, how should people manage their stress and fears during these extraordinary times?
Yes, these are very stressful and uncertain times. And certainly the hardest hit are no doubt the patients, their families, our healthcare providers, our other essential workers, people who are in our grocery stores, working in our meat factories, at TSA, driving public transportation, sorting our packages, delivering our mail. They're all out there trying to help us. And so they need to pay a special attention to their health, their psychological health. But besides regular PPE, all of us need emotional PPE. And what emotional PPE means is practicing good self-care. We're all isolated at home. We're socially distancing when we go out. And so we need to be very intentional in order to decrease that sense of loneliness and isolation, of reaching out, of calling our friends, of connecting with people, of intentionally creating greater interconnectedness with people, with family and friends. We also need to make sure we get enough sleep, that we eat nutritious meals, that you get a certain amount of physical activity every single day, that you change positions over the course of the day, get up, walk around, and that we also take breaks from our screens. Media is wonderful. It's our source for connection, but we also need to take a break. There are stress management techniques that people can use too, like mindfulness and deep breathing. You can find all sorts of ways of doing that on the internet. And then certainly if anyone has really...
I'm sorry to jump in, Kiki, but we're running out of time. Dr. Kiki Kennedy, we thank you so much for some great insight. And I want to wish you a happy Mother's Day and my best to Ted, you and the kids.
Thank you, Dennis. Just want to say, if you need help, call a professional if you think you may getting symptoms and needing concern about self-harm.
That's great advice. Dr. Kiki Kennedy, thanks again. Happy Mother's Day. We leave you now with some sights and sounds of our state capitol and our moment of calm.